Hi, my name is Melissa Green, and today I'll be sharing my presentation over language delays with y'all. The first page. What is a language delay? Language delays are a type of a communication disorder. It is common to see language delays, and they affect 5 to 10% of preschool-aged children. A child may have a language disorder when they don't meet the language developmental milestones for their age. And in the Head Start, many times we will hear that there is a lot of testing, but at the beginning we perform a Brugance test, which is over language, and then our speech pathologist will come in and perform her exam with them, and we will also do Lap D 4 times a year that will be able to diagnose a child that has a language delay. So we were able to help these children at 3 and 4 years old instead of waiting till they are in kindergarten. So this is pretty awesome, even though it's a lot of testing. Types of language delays that we often see. There are 3. Receptive language issues. Issues that involve difficulty understanding what others are saying. 2. Expressive language issues. Issues that involve difficulty expressing thoughts and ideas. The last one is mixed receptive expressive language issues. Issues that involve difficulty understanding and using spoken language. Causes of language delays. Genes and heredity. 20 to 40% of children with a family history that have language delays will have the condition themselves. Prenatal nutrition is very important. Research shows how prenatal folic acid can help prevent language delays. Hearing impairment. Children who are unable to hear can find communication difficult. And with the hearing impairment, Head Start also does a hearing exam. And if the child does not pass it when we complete the hearing exam, then they have to see a doctor, a professional, to find out what the problem is with the hearing. So that's also an awesome deal. Intellectual disability. Intellectual disabilities such as dyslexia can cause language delays. Risk factors for language delays. Being male, being born prematurely, having a low birth weight, having a family history of speech or language problems, or having parents with lower levels of education. Symptoms of language delays. We will see limited vocabulary compared to children of their age, has trouble learning new vocabulary words, leaves out keywords and confuses verb tense, uses certain phrases over and over again when talking, seems frustrated by inability to communicate thoughts, may not talk much or often, is unable to pronounce words and sounds. Signs for language delays. When we are dealing with the receptive language, we will see these forms of delays. At 15 months, does not look or point at people or objects. 18 months, does not follow simple directions. 24 months, not able to point to a picture or part of the body when named. 30 months, does not respond out loud or by nodding or shaking the head. At 36 months, does not follow two-step directions. Signs for language delays continued. With the expressive language, we will see these forms. At 15 months, is not using 3 words. 18 months, is not saying mama, dada, or other names. 24 months, is not using at least 25 words. 30 months, is not using 2-word phrases. At 36 months, does not have at least a 200-word vocabulary. And at 48 months, often uses words incorrectly. Types of evaluations for language delays. The first problem to rule out for language delays is hearing problems, and we already talked about that. If a child is a baby or a toddler, a free evaluation can be completed under the Individuals with Disabilities Education Act. Also, a pediatrician can request that a speech-language pathologist complete an evaluation on the child. And if the child is participating in public school, the school can also provide a free evaluation. Ways to encourage language development at home. Talk to your child from the time they are born. Respond to your child's babbling when they're a baby. Sing to your child. Read books daily. Take the time to answer your child's questions. And these 2 are my references that I chose to use. They were online to develop my PowerPoint. So thanks again for listening, and the reason I found this interesting is because I have a daughter who struggles with language delays, and so therefore this is always interesting to myself. Thank you.